Welcome to the world of rare disease, a show that focuses on awareness and education about rare and complex disorders. My name is Lisa Deck, and I'm a rare disease patient, a Rare New England board member, and your host for today's show. Today, our show features Emily Parks. Emily's lived experience as a patient living with chronic illness has given her insight opportunities to collaborate with hospitals and healthcare professionals across multiple healthcare systems. Combining her expertise in behavioral health with her lived experience of navigating multiple hospitals firsthand has led her down the path of studying the impact of medical trauma and medical PTSD on patients and their treatment. Emily recently launched her POP discussion groups to help support those experiencing medical PTSD. We have lots to discuss, and we're thrilled to have Emily here with us today. Thanks for being here, Emily. I want to start talking about living with a rare disease. Can you tell us a brief synopsis of?
Yeah, so I live with myopathic intestinal pseudoobstruction. The muscles in my intestine are too weak to digest and absorb food, and they were pretty dilated. So for 22 years, I was on IV nutrition or TPN to sustain my weight. I had a lot of secondary problems such as some liver scarring, line infections, and in December of 2020, I got an intestinal transplant.
Wow, yeah, so that is a big deal, but so it's been, what, 6 months or so, a little over 6 months, and
Yeah.
you're doing well, and it was a success, but it
Yeah.
ups and downs, of course, getting back on your feet after that, right?
Yeah, and it's a success so far. It's they don't measure it as it's like a success outward from the surgery. So still a success. Hopefully we'll stay a success.
Right. Well, good. Well, I hope so too. So what I want to focus on for this episode is a little bit about kind of the mental challenges, the emotional challenges, and talk a little bit about what you've done to help yourself and others with that. So let's talk a little bit about what it was like to be a patient and the emotional and mental challenges you faced over the past couple decades as a child and a teen and now a young adult.
Yeah, so definitely there was a lot of isolation, both in the hospital, but then when you were discharged, I didn't grow up. I went to a very small school, so I didn't have a lot of friends that could really, well, I didn't have any friends that could identify, but not a lot of friends who hung out with me because I was always in and out of the hospital. So definitely isolation was one. There's definitely a lot of anger, like the why me, or why do I have to do this, or when will this be over? Depression, definitely depression, because I was kind of popping in and out of the hospital maybe every 3 to 4 months. So that change from, just living your life to having to go into the hospital. I think as I got older, the biggest stress was because as we get older, we get more independent. We can make our own decisions. And then in the hospital, everything's decided for you. Everything's kind of monitored. And I think that was a big emotional thing for me to go from I can eat pancakes at 3 a.m. if I want to I have to ask for an aspirin.
Right. So that loss of independence, definitely.
Yeah, the loss of independence, being monitored.
Yeah, that's hard. And I think that's the realistic everyday feelings that go along with the rare disease. Of course, there's the medical side, but that emotional and that mental side is really something important. So as a patient, you've learned about those, and you've also learned a little bit about medical PTSD. And I wanted you to talk about that, but even maybe sort of identify and define it for people, because I don't know that everybody even knows that that is something that exists.
Yeah, so medical PTSD there's some research out on it and just the medical trauma in general. So the working definition that I have for it is medical PTSD is a disorder in which a person struggles recovering from either experiencing or witnessing a terrifying medical event. Such events could range from medical interventions required for survival to communication errors between patients and providers.
Right.
So it can be these big, large events, or it can be these small, more subtle events.
Right. And when you're a patient for your whole life, obviously those are things that you have dealt with. So you have identified this. Obviously, it's something that you feel you have experienced over time. I know it's definitely something I've experienced in my time as a patient. But what are you doing about it? You're not just sitting there talking about it. You actually are doing something. So I'd love to hear about that.
Yeah, so I started an organization called POP. It stands for Pissed Off Patients, and don't let the name deter you. Pissed Off Patients is more of not anger as in, I'm vengeful, but more of acknowledging that anger, that depression, that kind of suffering from interacting with our healthcare system, because it is very chaotic and there's a lot of moving pieces and we don't always know what's going on. And using that anger as a motivator for change. So that's the acronym POP. The organization, it's very small right now, it's just me, but I host bi-weekly discussions on medical PTSD, medical gaslighting, medical trauma, and all things about it. They're very free-form conversations. Sometimes I come in and I have a specific question, such as, do you experience what I call post-discharge depression, kind of the depression of getting back to your normal routine and kind of catching up, so to say. And I'm hoping to slowly do things like have more of a social media presence, host more groups. I'm in the process of building a website, building a Twitter. And my ultimate goal is to present presentations on medical PTSD to medical students.
Right. That's great. Yeah.
So they have that awareness.
Yeah, because that's something that they probably don't know exists. And it's a great perspective. And again, that's impacting the healthcare world so that it's better for patients. So again, it's sharing that patient voice and what you've learned personally from lived experience and, hearing from other patients, you're sharing that. So that's excellent. Could you also just define medical gaslighting, not an actual definition, but can you talk a little bit about that and the trauma? Because I feel like not everybody knows that term. So I'd love for you to share that with our viewers.
So medical gaslighting is very similar to normal gaslighting. It could be that, let's say, I witnessed a car accident and then the person I witnessed with was like, no, I didn't see anything. So then you begin to question what's real, or, you can kind of be fearful of bringing things up. So medical gaslighting is the same in the medical community. A direct example is I was once in the hospital to get a tube placed in my gastrostomy, and there was a micro perforation, so a little tiny hole that just healed on its own. But I remember outside the doctors rounding and saying that they were suspicious of a micro perf, and then coming in and being like, there was no micro perf. So then you begin to question, what are people kind of keeping from you? Why are they keeping things from you? Was there a micro perf or was there not a micro perf?
Right.
And why isn't it being talked about? And is there kind of concerns on lawsuits? Like, what is going on here that I cannot have access to what has happened to me medically?
Right. That's interesting. So really it's not knowing if what you are seeing and hearing is what you're seeing and hearing, or knowing it is, but then it's making you wonder, because what's happening? Why is this not being told to me truthfully and, transparently? So it's really trying to understand that.
It can also be subtler things like your symptoms not being believed, or your symptoms not being believed as prominently as they are, saying, oh, the pain can't be that bad. Those kind of small dismissals.
Right. And I think that,
which then you begin to question, is my pain that bad?
Right. Right. Yeah, it's interesting because that is definitely something I hear time and time again from rare disease patients. And, for example, one group that I hear about a lot is in the pain community. I love that you have a discussion group available for patients to come talk about these things. Where could one find more information about the POP discussion groups?
So we're definitely on Instagram. The handle is @pop_medical PTSD. There's also
Okay.
a Facebook group. It's so if you just put in groups, medical PTSD focus group. It's a discussion group. It's not like a official focus group.
Right.
And then on Instagram is where if you go into the bio and
Hmm.
you there's a link where you can sign up for events, and then that's also where I'll be posting about the Twitter and the website when they're finished.
Excellent. And is there a commitment? Is there a financial commitment to be part of the group, or is
Oh no,
there no? Okay, great.
they're
So
all
it's
hosted on Zoom.
yeah, perfect. So it's a free resource. That's excellent. I think that's a great thing to point out as well. So if anybody is interested in learning more about the POP discussion group, you can find Emily on Instagram, as she mentioned, and she will be growing that out as well. So we will also be hosting Emily as a Facebook Live. So we will be putting that out as well. So for Rare New England, we will play one of these episodes and have you talking about it. So we'll be able to put more information there as well. And before we wrap up, are there any final thoughts you have on this topic that you want to share with me or with the viewers?
Um, it's just that when I think of POP and I think of discussing POP with and medical PTSD with providers, I really kind of go back to the way like communication, conscious communication. So communication with a goal, and that can go two ways. And just really for any doctors who are out there listening, the way we communicate to people matters. So that can even be, and there's so many parts of communication too. I could go on and on, but there's a lot of nonverbal parts. So things like making eye contact, that's important versus looking around the room, and that you're always kind of on stage and patients are watching.
Right. Yeah, that's a great way to put it. Yeah, it's true. I mean, and I think as patients, we're looking at the doctors for advice and answers. Um, so the advice is be good with that, and try to.
Yeah, learn your style, learn your finesse,
Mhm.
and don't feel horribly embarrassed when you're called out by a patient, because I promise you will be called out for a patient by a patient, but usually it's hopefully constructive
Right.
instead of just
Right.
kind of blind anger.
Right. Yeah, well, all of these, illnesses are very emotionally charged because it's our lives. It's the doctor's lives, it's the patient's lives. So it makes sense. So I kudos to you for starting these conversations and having a place for people to discuss them, because I think again, it mental health and having an outlet and having peer support is so important. So I thank you for your conversation today and sharing everything and all the work that you're doing. So we very much appreciate it.
Thank you.
Okay. Before closing, we provide our viewers with an opportunity to share comments or ask questions from our prior shows. Rare New England in Motion is the perfect way to expand upon our mission of engaging with our community. Please send us any questions or comments to info@rarenewengland.org. We would also like to thank our show sponsors, Pfizer, Ultragenics, Vertex Horizons, and the law offices of Weiner, Jackson, and Simmons for your continued support. We are always looking for other sponsors and guests, so please reach out to us via our website. Thank you again, Emily, for being here today. We're thrilled to be able to talk to you. And that's our show for today. From all of us at Rare New England and all the patients and families who keep rare disease in motion, thank you for watching. And remember, when you hear hoofbeats, think horses, then think zebras. Thank you.